fait capturer.
Just to rule out, yeah.
WHO is saying, yes, we can end TB. IOM is saying, yes, we can end TB. Amen Foundation Belgium is saying, yes, we can end TB. The Rich Health Development Center is saying, yes, we can end TB. The is saying, yes, we can end TB. Lawyers are not saying, yes, we can end TB. Yes, we can end TB. Saying, yes, we can end TB. WHO is saying, yes, we can end TB. Amen Foundation is saying, yes, we can end TB. Lawyers are last saying, yes, we can end TB. IOM is saying,
Health. We welcome you to year 2024 World Tuberculosis Day. Yes, we can. And of course, because it is joining the rest of the world to celebrate this day. And to commemorate this day, we just had a walk. And of course, we are having now a stakeholders engagement and brief to discuss issues bordering around tuberculosis and how to completely eradicate tuberculosis in the state. Distinguished ladies and gentlemen, please let's put our hands together for ourselves for being part of this program this morning. Without much ado, let me quickly recognize members of the board. They will recognize the
present here with us this morning, I have the Coordinator Grant Manager, Ministry of Health, Dr. Biodu Omonoja. And of course, we have a whole lot of partners that is supporting this program with us. And of course, we have representatives here present. I have Damien Foundation, Belgium, Medical Advisor, Team Lead, Lagos State, Dr. Destiny. And Institute representatives of Institute of Human Biology, Dr. Bukola Olani, who is the Technical Director, BBM TB Iron Free Program, Lagos State, and of course I have Long Free Program, Lagos State, and of course I have Dr. Tokumbo Okubare, who is the Senior Programs Manager. Let's put our hands together. We have the Public Health Officer representing the International Organization for Migration, Dr. Emmanuel Linus. And of course I have the CEO, Ella, Dr. Enochukwu Adibu. From Debridge Health Development Center, DHDC. Who's here with us? Let's put our hands together for this. Society for Family Health, Upland Alliance, and of course we have a whole lot of supporters that are supporting this program this morning. Let's put our hands together. Health Service. Okay? So distinguished members of the health family here present, members of the press, distinguished invited guests, ladies and gentlemen. Without much ado, I would like to time this morning. We are going to go straight to the opening remarks, which will be done by the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, of course, who is ably represented this morning by the Director of Disease Control, Lagos State Ministry of Health, Dr. Rotimi Akolade. Let's look at
Good morning, everyone. Please permit me to stand on all existing protocols. I will still try as much as possible to establish the normal state protocols. So I want to take your indulgence also to just maintain my sitting position. First of all, on behalf of the Lagos State government, starting from Mr. Governor of Lagos State, Mr. Babajide Olushola Sanwo-Olu, the Honorable Commissioner for Health, Lagos State in the person of Professor Akin Abayomi, the Special Advisor to Mr. Governor of Health, in the person of Dr. Mrs. Kemi Ogunyemi. Both of them who are unavoidably absent this morning because of the EXCO meeting they are having currently right now. They would have loved to be here. Then my Permanent Secretary too, like we earlier heard, who I'm being represented in the person of Dr. Olusegun Ogboye. Then the Senior Special Assistant to Mr. Governor on Health. That's the person on my immediate sitting position on the right here, Dr. Mrs. Oluwatoni Adeyemi. Then, on behalf of the entire staff of Lagos State Ministry of Health, I want to say very warm welcome to each and everyone here present this morning once more. You agree with me that what we are doing today was supposed to have been done yesterday. March 24 of every year is a date we set aside purposefully in the TB program space to create awareness the more in the community, to create more sensitization to the community people of Lagos State Also to celebrate, we use this opportunity to celebrate the TB warriors. That is the infected and the affected, especially the infected tuberculosis clients who, by the special grace of God, have survived the terrible challenges of the tuberculosis infection. Also, we use this opportunity to commiserate with the families of those who have passed on as a result of the tuberculosis scourge. You agree with me that tuberculosis is still remaining a disease of very serious public health importance?
Simply because of the rate of spread of the infection and the pattern of spread of tuberculosis infection. Of all the infectious diseases, tuberculosis still remains the disease that we need to really be very focused on. With an unencouraging statistics of, let me say, about 15 to 18 tuberculosis related deaths in Nigeria every hour. And a situation where the country is still being documented to contribute, to be in the 6th position globally among the highest burdened countries worldwide. Also, Lagos State with a very high population of about 28 to 29 million. We contribute about 11% to the national body. You agree with me that with this unencouraging program statistics, we still have a lot to do as a state. Although the state, right from inception of the program, we really put in a lot in terms of different interventions that the government has committed itself to. But you are aware that there's nowhere in the world, both at the national level, sub-national level, even at the local government level, that the government can, survive or sustain the financial responsibility of combating this particular disease all alone. So we relent, we don't relent in effort to make sure whatever we can do, we put in all our best in terms of screening, in terms of investigations, in terms of treatment, in terms of management. And you agree with me that combating this disease, managing it, both in the facility and the community, demands very huge financial commitment. So in this wise, it's no news that we need to really implore the support and the collaboration of different international funders and implementing partners who have been supporting the states in this particular combat against this disease. This is more reason why we are having a good number of international funders with us today, implementing partners. So on behalf of my principals, I want to immensely appreciate and say very big thanks to each and everyone that is here present today. To just take time a bit in the bit to show the level of appreciation the government has. To quickly just mention our international funders and the IPs that are present here in this room today one by one. We want to appreciate the fund.
TB rate is about 6%, which is far below the average between 10 and 10% for childhood TB. Our private sector detection rate, notification rate should be is currently 25%, which is low below the estimated national rate according to the national strategic plan of national TB control program, which is about 35%. So we can see that all hands should be on deck. We are a little bit below the rate, even though we are doing so well in other aspects. So that's why we need to use this opportunity to, as we are celebrating the World TB Day today, we also need to not to rest on our hands, to put all hands on deck to ensure that we are all children, all adults, everybody affected by TB is notified and placed on treatment. You know, this disease is very infectious and it's going around all over. Also, that's why we must ensure that all work together, all our partners. I don't want to list all the partners. We have WHO, we have SIHP, African Alliance, IHB, DLD, and so on. We all work together to ensure that that we put a stop, we interrupt the chain of transmission of TB. And also, one thing we need to also pay attention to is the issue of awareness creation. I noticed there is a study done in Nigeria that says that less than 30% of our population are aware about signs and symptoms of TB. If less than 30% of the population is aware about signs and symptoms of a disease, how do you want to eliminate that disease? So that means we should create awareness in various organizational finances, not just for state TB control program at the state level, even at the NG level, even at our level as organization. We must ensure that we create awareness about TB. It's when you create awareness about the disease, that's when the disease can be eliminated. We've done that for polio, and we have ended polio because every nook and cranny of the country knows about polio. So the same thing, we can do that to TB. So if you all create awareness, awareness is the key, because if awareness is well created, we have solved 50% of our problem in TB eradication and control in the state and country at large. So at this juncture, I want to say, I wish everybody a joyful celebration of the commemoration of year 2024 World TB Day. Thank you.
Thank you very much. Distinguished ladies and gentlemen, it is now time for goodwill messages, and we will be allotting just a minute for each speaker, please. Kindly note. So I'll start by inviting the representative of the World Health Organization. I have the State Coordinator, World Health Organization, Dr. Chinyere Okafor.
Thank you. I'll try to do it in 1 minute. I welcome everybody here. I'm standing on the existing protocols. I welcome all partners here. I just want to congratulate the Lagos State government for this for commemorating the World TB Day 2024. Like every speaker has said, previous speaker has said, TB is a very infectious disease. Data from the African region of the World Health Organization says that one person is infected every, both of them, one person is infected every 30 seconds. And in 2022, we had 444 deaths, and which showed that we lost one person every minute in the African region in 2022. This shows us how infectious TB is, and that we have a long way to go. Looking at what we want to achieve, we're looking at sustainable development goals, which we are still far from achieving. WHO is ready to support the Lagos State government with our country cooperation strategy, which we have. We are focusing on 5 strategic priorities, of which one of them includes research. We're ready to support research with regards to TB. In addition, Lagos State has about 100 foot soldiers, WHO paid officers working in Lagos State. So we're ready to support. And these are the policy structure. It's great to hear that the feats we achieved with WHO supporting the government, and we're able to eradicate polio. So these foot soldiers are ready to ensure that we have a high level of awareness created down to the world level. Also to mention, in 2022, during the 72nd Regional Committee, where all ministers of health in the African region met in Togo, the focus, to reduce the burden of TB came up. However, it was noted that a particular group is being overlooked, and that is childhood TB. So WHO focused on childhood TB, and also in conjunction with the government in the African region, and it was noticed that a 20% increase in detection of child pediatric TB compared to the previous year was noted. So this shows that children are also affected, and we have a long way or a lot of work to do to ensure that we're able to pick out the most vulnerable population amongst us, because we know that children are the promise of tomorrow. So I want to thank the Lagos State government. The commissioner is not here. I want to thank the Lagos State government for what they've been doing so far. Lagos remains a trailblazer compared to other states in Nigeria. Lagos is in the forefront with regards to achieving the sustainable development goals. I want to thank everybody here present, and I wish everybody to keep having the slogan in mind that yes, we can end TB. Thank you.
This opportunity to commemorate the World TB Day. I bring you greetings from the country rep, Madam Ivy Joy. Today, as we stand together, united in our commitment to eradicate tuberculosis, as well as alleviate the suffering it inflicts on millions worldwide, we recognize the urgent need for us to collectively collective action and solidarity in combating this ancient disease. And this is through our sustained advocacy, investment in research, and equitable access to healthcare and treatment. We can realize a future free from the burden of tuberculosis. Thank you very much.
I would like to invite the representative of Center for Integrated Health Programs. Please step forward. Thank you very much. Let's put our hands together for him as he steps forward.
And also our partnership with the Lagos State government and the TB program. CIHP as an organization, being a major implementing partner for the HIV program in Lagos State, has also had an unwavering commitment towards ending the tuberculosis and the burden of tuberculosis in Lagos State. We have so far so good. In addition to implementing our HIV programs, we also look towards ensuring clients who are co-infected or have index of co-infection with TB are properly screened, leveraging on referral system, sample referrals, and ensuring that all clients who are assigned to be or assumed to be presumptive are referred for proper TB screening and treatment. And in addition to that, we also are tackling the third eye, which is TPT, tuberculosis preventive therapy, which is our own efforts towards preventing new TB cases, of which we could say for this quarter and between January to now, we have initiated over 700 clients on TPT, both adults and pediatrics. So again, our commitment to saying yes, we can for TB is there. So just thank you very much.
This is Ella, Dr. Elochukwu Adibo.
Lagos State is always a trailblazer, setting the pace in celebrating this year's World TB Day. It's been an annual event, and this year is no different. But this year we are more determined than ever to say we can. We can indeed end TB. All of us seated here should have that resolve, should have that commitment in everywhere we can. The most important thing we can do is to pass the message. Does your neighbor know anything about TB? We have different socioeconomic classes, A, B, C, D, E. TB is no respecter of socioeconomic class. The E can get it across to the A. So being an A class does not mean you cannot. So please pass the message to everyone around you how TB can infect and what we can do to prevent this. We are committed as one of the key laboratories that is responsible for testing And diagnosis is a key component of care in TB. If you can't diagnose, you can't go to treatment. So we shall continue to commit our resources and all we can do to testing of TB. And we also want to let you know the organization will have more commitment in disseminating information. And the program manager said only 30% are aware of TB. We need to do much more than this. By the time we celebrate next year, we should have made the whole Lagos, wherever we are, know about TB and what each and every one of us can do to stop TB. We are more committed, and let all of us resolve to more commitment to this task. And we shall end TB surely together. Yes, we can indeed end TB. Thank you very much.
Distinguished ladies and gentlemen, representing the National Organization for Migration, Public Health Officer, Dr. Emmanuel Niles. Let's start.
Thank you, everyone. Let me stand on the existing protocols. I want to start by thanking the Lagos State Government, each and every partner here that has actually put hands, feet, and brains together to see that this day comes to fruition. When you think of migration, you think of IOM. We are the gatekeepers for the spread, to prevent the spread of tuberculosis across borders. Tuberculosis, just as has earlier been said, it is a global problem. And whether we like it or not, there is stigma attached to it. Countries that have made efforts to see that this disease has been brought to the barest minimum have tried or is trying and will continue to try to see that people do not move into their countries with TB. So IOM are the gatekeepers to ensure that everybody who travels in a more dignified and a safe manner. So IOM is collaborating with the Lagos State Government to make sure that not just people that are within the communities, but even people crossing the borders are screened and get the necessary treatment and care with respect to tuberculosis as per our developmental goals. So yes, we can end TB. We will continue to do as much as we can. We will bring more hands on deck. And when we ensure that our migrants are healthy, I'm sure our communities will also be healthy. Thank you very much.
Representative of Heartland Alliance, if you are here, kindly step forward, and you have just a minute, please. Thank you very much. Let's put our hands together for her to step forward.
Good afternoon, everyone. Standing on the existing protocol, on behalf of all the management in Heartland Alliance, we want to sincerely appreciate Lagos State Government for their support in the integration of TB/HIV services in Lagos State. All the achievements Heartland Alliance has made in Lagos State couldn't have been possible without the support from the Lagos State Ministry. At facility level, there has been an improved and increased TB screening among people living with HIV, and there has been an increase in presumptive yield from 6% to 11%. And TB cases among people living with HIV has also increased from 8 to 15%. And this was made possible by the support from the Lagos State Ministry through our health facility. And at the community level, we support about 13 to 14 standalone door sites, providing HIV testing services to all identified TB cases. And this has improved the number of TB cases with documented HIV status from 55% when we met them to 92%. And we hope, we are not yet there because the aim is to achieve 100%, but we hope that with the support the state government is giving us and with support from other TB partners in the states, we are sure that we will achieve the 100% benchmark. And on behalf of Heartland Alliance Management, we'll join the rest of the world to say, yes, we can end. Thank you.
Distinguished ladies and gentlemen, at this point I would also like to invite the representative of Institute of Human Biology, Dr. Tokumbo Okubayi.
Thank you very much. Good morning, everyone. Happy World TB Day. I think our slogan is that we can end TB. And I particularly like the one that we have going along with the Nigerian slogan, no grief for TB. I think that is quite apt and it will pass the message across. So, Ms. Dr. Adetokunbo Okunkuri, SPO Childhood TB and Contact Investigation for the Southwest Zone under the TB Laundry Grant. Standing on the existing protocol, I would like to thank Lagos State for this wonderful collaboration for the World TB Day. I'm also bringing greetings from our managers, our CEO, Dr. Mensas and Dr. Dakum, our Chief of Party for our TB Laundry program as well, Dr. Aderonke Agbaje, and of course our Director of Technical Programs, Dr. Lubenga Daniel. They are here with us. They would like to have been here with us physically, but of course, due to so many exigencies on their part, and they also are attending programs and meetings as well, they are not able to be here. However, we are here as representatives of IHVN, and IHVN, as you know, is a non-governmental organization. We are very much involved in the TB program. Apart from TB, you know that we delve into other infectious diseases, but today is World TB Day, and we will focus on TB. Under TB, in collaboration at all levels of government, federal, state, and local government, even to the grassroots, we are very much present because we really believe in stepping out TB from our environment. This is something that we are quite passionate about at the Institute of Human Virology, which I am sure that over time, working in collaboration with government partners, collaboration with other implementing partners and sub-recipients, you have seen over time. This is something that we have vowed, and we are actually, we back our words by action. And that is where the passion for IHVN employees and staff when it comes to stemming out TB from the environment and of course from our community. So thank you so much for having us here. We'll continue to collaborate with other partners, with the states, with the government, federal, local levels as well. And we'll continue to collaborate with our other partners. Thank you very much.
Mrs. Deborah Ike, and on behalf of the entire DHDC team. Okay, on this occasion of World TB Day 2024, we congratulate the Lagos State government and we congratulate everyone here because it's a step towards achieving our goal of ending TB. We also like to call the attention of everyone here that today's work, today's occasion is not just any other occasion. It's basically to make all of us to have a recommitment to end TB by 2030, as it is said. I also want to call the attention of everyone here that a lot is being done by Lagos State government. A lot is being done by implementing partners. A lot is being done by many people. But you know what? It is not enough. This occasion of World TB Day 2024, let all of us come together and say no to TB. Let's all work together to end TB. Thank you very much.
Ladies and gentlemen, that's about it for the messages. So at this point, we are going to have the keynote address. And to do us the honor, I'm inviting the Honorable Commissioner for Health, Lagos State, Professor Akin Abayomi, who is ably represented here this morning by the Senior Special Assistant to the Lagos State Governor on Health, Dr. Tony Adeyemi. Let's put our hands together for him.
Thank you very much. Good afternoon, ladies and gentlemen. And then welcome back for all those that actively participated in the work, because I would like to congratulate you that you've already done your exercise quota for today. So a round of applause to you all if you actively participated in the work. Okay, so I greet you all this afternoon. I would like to please stand on the already established protocol. I greet all our partners here present, and I thank you for all that you're doing for Lagos State. I bring you this keynote address on behalf of the Honorable Commissioner for Health, who is unavoidably absent because of Exco meeting today. So I'm honored to stand before you today at this significant occasion, the commemoration of the year 2024 World TB Day. As the Honorable Commissioner of Health in Lagos, it's my privilege to address you on the theme. We've forgotten that theme already. Yes. Let's be very confident about that thing, because I know we're tired, but I mean that's our theme for the year. So the theme for year 2024 World TB Day is Yes, we can end TB. Indeed, yes, we can actually end TB. As we all know, tuberculosis is a disease that has plagued humanity for centuries, and it continues to be a significant public health challenge. It affects millions of people around the world, causing immense suffering and loss. The state TB leprosy program in the Ministry of Health notified and placed on treatment 18,546 patients in 2023 alone, which is quite commendable. However, despite challenges that have been faced, I stand before you today with a message of hope and determination that yes, indeed, we can actually end TB. The theme for this year actually serves as a very powerful reminder to us all, our partners, even us at the state government, that our collective efforts, commitment and collaboration, we have been able to bring an end to tuberculosis. So it requires our collective efforts, it requires our commitment, and it also requires collaboration. The theme is also a call to action, that for all of us to work together, we need to work together towards a world free from the burden of TB. And as Lagos State, we are actually doing a lot concerning TB. We have 3 mobile trucks, and then we have a champion for TB in person of the First Lady, Dr. Mrs. Claudiana Ibijoke Sonwo-Olu. She's a TB champion, and she's been a TB champion since 2019. And then she stands and actually represents and champions the cause of TB. Also, currently, TB is free. The diagnosis, even from the screening, diagnosis, and treatment of TB is currently free in all our health facilities, starting from the primary facilities, the secondary facilities, and free, courtesy of the state government and some of our partners that are here present. I think the state government deserves a round of applause at this point in time. So as we gather here today, let us reaffirm our commitment to the cause. Let us pledge to increase awareness, improve access to healthcare services, and support research initiatives aimed at developing better tools for TB prevention and control. Let us empower our communities and individuals to take proactive steps in the fight against TB. I call upon all our stakeholders, so this is a renewed call for action. We thank you for all that you have been doing for Lagos State in the past, and then we now call upon you, all our stakeholders, the various government agencies present, healthcare professionals, civil society organizations, the private sector, and the general public to join hands in this noble endeavor. Together, we can make a difference. Together, we can end TB. I would like to express my gratitude to all those who have tirelessly championed the fight against TB. Your dedication and perseverance inspires us all to continue our efforts. Let us seize this opportunity to reaffirm our commitment and take decisive action towards ending TB once and for all. In conclusion, let us approach the challenge of tuberculosis with unwavering resolve and optimism. Let us believe in the power of collective action and the potential for positive change. Yes, indeed, we can end TB, and we'll do this together. Thank you very much.
Through this, it was a very short notice I was given by the TB team. The theme, as the SSA had reiterated on behalf of the Honorable Commissioner, yes, we can end TB. And she actually mentioned in the HCA speech that it's all about a collaborative effort. So on behalf of the Lagos State Ministry of Health, the Honorable Commissioner for Health, Mr. Akin Abayomi, the Permanent Secretary, Dr. Olusegun Ogoye, the Director of Disease Control, who is right here in our midst, the Chief Host of today, that's Dr. Agbola Gorite, the Senior Special Assistant to the Governor, Dr. Tony Adeyemi, as well as our partners. WHO top on the list, World Health Organization, Dr. Chineye, thank you for always being there for us on the state. IOM, we appreciate you. IHBN, thank you so much. CIHP, Heartland Alliance, who else have I not mentioned? Health Laboratory. We are only on twist in the State Ministry of Health. And you know there are other days that is also forthcoming. World Malaria Day is around the corner. World Hepatitis Day is knocking on. And Sickle Cell Day is also coming. So it's not only about TB, it's a collaborative effort. And we know anytime we call on you, we will always be there for us. So on behalf of the Honorable Commissioner for Health, as well as the Permanent Secretary, I want to appreciate each and every one of us. First, for the love all of you partners have shown to us, your dedication towards us. We want to appreciate you all for always being there for them, for us. And I want to say again, yes, we can all end TB. Thank you very much.
Thank you very much, Dr. Yonchu.